For many people, pets are an integral part of their family.
And when their beloved pet is at the end of his or her life, it can be a painful farewell at a veterinarian's office. And that's where Dr. Azure Holland comes in. And this is so interesting, talking about what you offer to people, pet owners who are in those last stages. Tell us, for our viewers, what you do.
Well, I'm Dr. Azure Holland. I'm a doctor of veterinary medicine, and I do house calls.
But the house calls, as well as general veterinarian care, you offer hospice and end-of-life care as well.
Yes. I started this business about 6 months ago now, and I was inspired from, well, let me back up and say I was inspired from where I'm from. I'm from Bailey, North Carolina, and it's a small town east of Raleigh. And growing up, my grandmother had a farm. She had hogs and chickens, farm dogs and cats, and I would go with my grandfather on the weekend and help, feed all the pets and animals. And I decided at that point that I wanted to be a veterinarian and pursued that career. But the inspiration for my latest business is a family dog that we lost a few years ago. My dad called me on a Saturday, and his tone was just very serious and sad, and he said, "Azure, we need you to come help say goodbye to Venus." And when I got home, everyone was in the yard around her. She was in her favorite spot, and we were all able to send her on her way, very lovingly.
So the way that you handle things now with your house calls, it's a very sweet way to say goodbye. It's a lot different than a hospital experience, isn't it?
Yes, it is completely different. The main word I think of is comfort. The family has the privacy to grieve the way they need to grieve in their own home. And the pet does not have to, have a car ride that maybe he or she doesn't like, and then getting to a hospital to see a veterinarian that, in the past may have been giving vaccines or doing other medical procedures.
Going to a vet's office can be very traumatic and nerve-wracking, causing all sorts of anxiety for pets.
Yes, and I see it every day. I'm in general practice in Raleigh, and it is not, for most pets, it is not their favorite place. And so I do think that it's not, if they were able to say, it's not where they would want to say goodbye.
How do you know it's time as a pet owner?
That is the toughest question, toughest question of all. And a lot of it is about, talking to your pet. I know that sounds maybe a little crazy, but getting a read about how they're doing wellness-wise. Are they eating? Are they enjoying their activities still? Are they able to walk? Are they in chronic pain? And my website actually has some really good resources for trying to figure out, if it's time and, when it's time to say goodbye.
And maybe a visit to your veterinarian can help decide what sort of the quality of life issues are left for your pet?
Definitely. So going just to, to your regular veterinarian, they can do blood work and do a physical, maybe some x-rays, and help give you an idea medically where your pet stands. But then the other component, I think, is emotional.
Sure. And that may take a lot longer to get to.
Right.
Yeah.
Right.
Azure, thank you so much.
Thank you.